Welcome to Medicine Redefined, a podcast focusing on helping you reclaim ownership of your health. I'm Dr. Darsha.
And I'm Dr. Altamash Raja. We're your hosts, here to challenge conventional practices and uncover the stories behind pioneers shaping the future of medicine.
Our conversations not only focus on the individual level to dissect common practices for health optimization, but also zoom out to enhance systemic change.
Join us as we look to break the status quo, move the needle forward, and put the health back in healthcare.
All right, Ravi Hariprasad, round 2 here with us. Thanks for coming back on.
Yeah, it's a pleasure.
Round 1 was awesome. For those who haven't gotten a chance to listen to that, highly recommend it. You really set the groundwork about mental health in that episode and zoomed out, talked a little bit about the philosophical approach to mental health and why PCPs are really taking on the burden and where psychiatrists can come in and really round out the crisis that we're in. And then you had the brilliant idea of saying, let's talk about suffering, right? And why humans maybe choose to suffer. And so this conversation is definitely going to be a little bit more meta, a little bit more philosophical. As you said, we're going to be talking about the spirit. So for the listeners, I urge you to stick with us. A lot of perspective might be shared that you haven't thought about. So at any time, pause the episode, think about how it might relate to you for some introspection, or even extrapolate it to what you see around the world about human nature, human condition, etc. But to start off this episode, right, we're going to be talking about suffering. And the Buddha has said that all of life is suffering. And essentially in Buddhism, the end goal is to become enlightened so that you can end that suffering. So with that heavy statement, Ravi, what is suffering to you? How would you define it?
So I think it's the first way to step in breaking this down is to make a distinction between pain and suffering, right? And if I were to come up to you, Darsh, and pinch you, you would be like, ouch. And that would be pain, right? And that's objective. And I don't know that you would suffer. You would just be a little bit confused, a little bit stunned, and you'd feel like a little bit of a bite or a pinch sensation on your shoulder. But if you thought about it a little bit more, you might be like, I can't believe that guy Ravi. I can't believe he did that to me. He's violating my personal space.
That guy.
He's like, what's he doing? There he is again. Oh, how many times have I told him to keep his hands to himself? And then all of a sudden begins this internal dialogue in this cycle, this almost superimposition on the objective experience of pain that occurred. And that's the suffering. It's a subjective perception that has to do with the stories and labels that we put on things, as opposed to the objective experience that's unavoidable. And so humans are really interesting, right? Because they're probably one of the only animal or life forms that can actually suffer. The rest of them are like, ah! And then they just move away and get on with it. And maybe they have a little bit of memory to prevent themselves from getting burned by the fire again. But they, go on chewing grass and moving on their merry way. But humans spend a lot of time in their head. So this is the distinction between pain and suffering, as I conceptualize it.
Yeah, that's super interesting. I loved how you distinguish between the subjective and the objective, right? And I think it's important for people to realize that there's this internal dialogue that comes along with suffering. Why do you think humans choose to suffer, maybe, right? Because if it's a subjective experience, there has to be some sort of choice in the grand scheme of things.
Yeah. And so this is the subject matter of the venerable Eastern philosophies of the world. The subject matter of Krishna's Gita and Buddha's teaching is that we must learn as humans that to suffer is optional and to pain is mandatory because it's objective. And I think the best way to look at it is this is the root cause of the human condition.
Yeah, it's interesting. Root cause of the human condition. So for those that might not be attuned to what the human condition is, how do you explain that to somebody?
Yeah, it's a good point. So you know, so here's a expression that might help. Suffering is the soil, and resilience is the seed, and growth is the plant that emerges. And we're all kind of gardeners of the soul. And if you think about it, it's kind of like we get that seed of pain, and if we foment it in our mind, it grows up, and that becomes our experience. And so it's kind of like what we focus on as humans that blossoms. And so if we're focusing more on the positive aspects of life and experience rather than the negative experiences, then that too becomes our life. This is There was a great Indian philosopher, Swami Vivekananda, who, in 1900, around the turn of the century, he represented the Indian philosophy at the World Congress of Religions. Great philosopher, Vivekananda. And in one of his writings, he pointed out that he made a metaphor of a bee and a vulture. And these are two creatures that spend their time searching, right? You got a vulture who's flying around in the sky looking for its next meal. And so it's looking for a rotting carcass. And when it sees it, it just dives in from a mile in the sky and starts eating. And, I was on a safari not too long ago, and I saw this phenomena, and you could see another vulture land next to the carcass, and they were all fighting each other over it, right? So that's one part of it. Then you got a bee that spends its life buzzing around from fragrant flower to fragrant flower, extracting the nectar of these flowers, right? And interesting. There's a total connection between the two. They're looking for what they want. The difference is, on their deathbed, the bee had a glorious life filled with fragrant flowers and nectar, and the vulture had a life of scarcity, searching for rotting flesh and fighting off people who would steal it from them. So, from that standpoint, we can then understand the human condition is kind of straddling between these poles. And sometimes we allow the vultures in us to take a life of its own and root, and that becomes the life and the subjective experience, the journey through life that we experience. And on the other hand, sometimes we spend a life of kindness, compassion, love, joy, generosity, and abundance. Hey, brother, I only have a loaf of bread, but you can have half of it. Let's hang out. And like the love, it becomes the story of that life. And so the human condition is something of a struggle in our mind to decide which of these tendencies we fall towards and which ones we don't. And and you know, um, uh, yeah. And
Yeah.
so I think that illustrates the point.
No, yeah, absolutely. I love the dichotomy, right? I think that's so accurate about human nature is that we see things so circumstantial, so situational. Even talking about destiny versus free will, right? We tend to choose when we want to believe in which philosophy. It's destiny when we meet our partner, but it's free will when something doesn't really work out for us, right? And so to really push on the philosophy button here, I really wanted to ask you about the power of existentialism. And for those that don't know what that is, right? Jean-Paul Sartre wrote this book called Being in Nothingness. And it's about how life is meaningless, right? It's you take a paper, light the fire, life is whatever. But there's a lot of power in that, right? It's almost as if you realize you're just a monkey on this rock floating in space and you're minuscule. And there's something freeing about that concept. Versus now we talk about logotherapy with Viktor Frankl, and many people might know his book, Life's Search for Meaning, where he was a Holocaust survivor, former psychologist, and his whole idea is logotherapy, which is finding purpose in life, and that is the main goal in life, right? So two contrasting philosophies, but both having some sort of deeper meaning behind them, right? So how do you see that dichotomy about meaning in life and purpose, and maybe tying that into like the human condition?
Well, so I mean, Viktor Frankl was amazing, right? Like this guy is in a worst possible situation. I think he was in Dachau, right? And
Mm,
like he was watching his uh, people being incinerated.
yeah,
The ashes were filling the sky, and he was trying to figure out how to come through this. I think it was Man's Search for Meaning, right? And so
correct. Yeah,
he basically painted out the story of how we can find a deeper meaning in the suffering itself, right? So, like, finding meaning in suffering is like turning a poison into medicine. What once harmed you now heals you. And so, at one level, the Eastern philosophies have well established this, both in the Buddhist tradition and the Vedantic tradition, and several other mystical traditions. The belief that the world is fundamentally a waking dream. And it's a little bit too far down the rabbit hole to get into the proof of that or how that is derived. But let's say that. And so then that lends itself in a way to existentialism on the surface. But on the other hand, if the purpose is then to wake up from that dream, which could be a nightmare depending on whether you're in your vulture tendencies or your honeybee tendencies, then the suffering is what allows us to climb out of it. Right? Like we don't really grow as humans when we're having a good time. It's in the suffering that we actually grow. And that growth is the point of life. And so I think you need to link these two views together and understand that they're all part of a complete holistic picture of what it takes to wake up that person who's being like a vulture and shake them back and forth and get them to snap out of it. And that's what the suffering is for.
I love that because I think a lot of people hold on to the idea of being a purist, right? You can't have multiple philosophies in your head. You cannot believe in destiny or free will or existentialism or logotherapy. You have to choose one. But like you said, you use that word growth over and over and you said that's the true meaning of life is really finding that growth and whatever may come with that. So just to confirm, you do agree that it's okay to have these multiple philosophies circumstantially as long as it comes back to the idea of growth.
Yeah.
Gotcha.
It's kind of like the art of being human, right? Is like to dance in the rain with full knowledge that the sun is going to shine again.
Gotcha. Love it. So jumping on to the next sort of philosophy here is Stoicism. And, Altamash and I are both fans of Ryan Holiday, who has really brought Stoicism onto social media and for a lot of people to tune into and relate to. And Stoicism tends to be maybe one of the more practical philosophies because it's not really rooted in a sort of spiritual way, but it's more of an actionable, here are tips that you can take away, right? And one of the big aspects of Stoicism is this idea of control, right? You look at Marcus Aurelius, Epictetus, they all talk about how you as a human are in control. And that's the biggest power that you have, even probably towards growth. How do you view control and suffering? And how is it possible that humans can now use that idea of control and action to reduce their suffering or even change the way they think about suffering?
Yeah, so my perspective is that control is overblown. I mean, if you think about it, for anything to happen, right? Like, okay, we're having this podcast and we're recording it right now, right? And we could say that we wanted to do this and therefore it's happening, right? Um, and there's some truth in that. That's one variable. And so it's a choice that we have control over, right? That we come together and we make this podcast. But actually, there's 1,001 variables that have to come in synchrony for this to happen, right? Like our internet connections, they have to hold out. It's still a miracle. Sometimes the video stutters a bit, but we've got that. So, and then think about all that went into making sure that internet connection worked. Then our health. Both of us had to have not eaten the wrong thing for lunch and had enough sleep and be in good shape. That's also something that's not under our control. And when you stack it up, there's this kind of humbling sensation that, oh my God, stuff is just happening. And like I'm showing up with the one variable that's under my control and then claiming responsibility for the entirety of the outcome. And that's a cognitive error we make. And as a result, we end up with suffering, because when things don't go our way, we start saying, I'm an idiot. I did this. I didn't do that. I could have done this. I could have done that. But in truth, we can only make the effort, and the outcome of the action is I guess, to use an old school word, grace, right? Everything had to come together and make it happen. So that's the kind of the tie-in between control, the perception of control, versus actually having control, and our perception of suffering. The other flip side of this is on the topic of acceptance, right? If we can accept what is, then it doesn't really cause us distress. We might be sad about something or feel something's unfortunate, but we accept it. It is what it is because it is. On the other hand, if we have resistance to what is and we don't accept it, then we're going to have a lot of suffering. Because we wish it were this way. I should do this. Why didn't I do that? And the whole mental story is keyed off of it. And again, if you look at it, the root is control, the perception of control, the belief that there was any.
Ravi, I'm so glad that you went there. Darsh, it's funny that as you brought that up and initially asked a question, and my first thought was kind of what Ravi's saying is there are very few things that are actually in our control. And I think the fallacy is that a lot of people are under the perception that there is in fact more in control than there actually is. And we go around pretending that. And when the moment we realize that something is not in control and that's front and center in front of you, and that's when that's a source of anxiety, immense amounts of stress, dare I say suffering. And, I'm wondering, as we've been talking about this, there's this concept in DBT that I've recently come to learn about, radical acceptance. And Darcy, you talked about growth, right? A lot of people getting excited about reading self-help books, right? Some of Ryan's holidays even geared towards that is to make you realize that how can we use stoicism and apply it to modern day philosophy. And ultimately the goal is for growth. But in this concept of radical acceptance, a lot of times, people will talk about, those who practice DBT will say, look, you are who you are, and you don't need to necessarily grow or change, and just come to terms with that. And so I'm wondering, because I think the three of us are here, we're even having this conversation, we're certainly in that maybe even minority of people who want to change what is, want to be better, want to grow. But there are a lot of people who are just content. They've already accepted. They don't necessarily need to change. And also is going to, I think, lead into later on when we talk about, why is it some people who tend to suffer a lot more? You talked about when Darsh is perseverating with the fact that you pinched him. Why do some people go down that rabbit hole and for days and days and days can't get over the fact? And it's taught at a very young age. Do we have a sense of what might create that archetype of a person?
That's interesting, right? I mean, the point is, control is like this illusion. It's like trying to grasp the wind, and peace comes upon us when we open our hands and let the wind just move through it, right? And I think it comes down to ego. And ever since the first baby was born, and everything was taken care of it in the womb, and it got its food, all of its bathroom needs were taken care of. It didn't even have to open its eyes. Everything was good, right? Occasionally mom would move around, but then all of a sudden, whoa, out of mom and into the world, and just what is going on here, right? And then the sensation of hunger came. Like, what is this? And then this terrifying feeling of, I might die. I might cease existing if I don't get milk or food. And then we need to act all of a sudden. And in order to act, it's as if we need to have an identity, a personality, and and then that formation creates the ego. And this ego is now trying to act on the external world in order to get its needs met. And depending on how that ego is raised, and so this is the Freud's entire shtick on ego psychology. We have our various personality structures that have various levels of reaction to external stimulus, right? So the baby that got undergratified, so they had to scream and scream and scream and scream until they were blue in the face till someone would show up with some milk, right? Versus the one that snap their finger and the milk shows up in 2 seconds. Yes, yes, Your Majesty. These lead to very different character structures and organizations on their belief on what is going to happen when I have a need or a want. And so I'm bringing it down to that elemental level because that's literally Altamash where the line is drawn. It starts at that young age on how I believe, how safe I feel, how secure I feel, how I believe my needs are going to be met, and how much I need to act, how much screaming and hollering do I need to do in order to get what I need. And it turns out, just as a quick cheat sheet while we're down this rabbit hole, the optimal, there's something called optimal frustration. A psychologist in the 50s, D.W. Winnicott, pointed out to parents, look, if you overgratify a child, you mess it up. If you undergratify, you mess it up. There's an optimal frustration, which is suitable and consistent with living that creates the best possible scenario. But does that answer your question? I think.
Most certainly. I really love that. It reminds me of a phrase that Aline, a previous guest, came on, and she would talk about ILEs, inconvenient life events. And I'm wondering if I'm going to start using this. And anytime something seems that it is a bit frustrating, I'm going to say, no, this is optimal frustration. This is exactly what we need to move on to the next level. I'm curious about that. I'll call it conditioning, kind of at that young age. And you're talking about when the child realizes that, okay, that, they need to maybe create more of a fuss before they get whatever it is that they need at the time. Is there a certain age period that you're familiar with where that starts to develop?
Yeah, I would say 0 through 4 years old, and it is exponentially more important younger. So there's like this decay function where the ego is forming, and yeah, it's critical during that period, and that's why these childhood traumas can be so impactful. Like the sense of abandonment, a parent wasn't there for me, feels like it's a permanent fixture, even though it was just for 2 years. Compared to someone who's 50 years old, it'll leave a sting that lasts for decades.
It's crazy that we're talking about this today. I was just seeing something on social media come across yesterday. I forget this guy's name. He's a pretty prominent, I think he's a psychologist now. I know he was on Rogan for quite some time. He talks a lot about childhood development, parenting, and gentle parenting, all that kind of stuff. Gaber Mate, thank you so much. Amazing. Yeah, and he was talking about how the first 3 years of life are so critical in terms of dealing with your children. And, Ravi, I've got a daughter. She's just over 2 right now. And I was like, oh my God, I've already screwed up the first 2 years. I haven't. But, you just think about when you see those things about how you could be more present. And he was talking about, trying to minimize screen times and whatnot. And, without judging myself, you think about, oh my God, like, why is that window, the first 4 years we're talking about, so critical? But those developmental milestones, which again are a lot of times focused on the physical aspect, can they stack up cubes? How many steps can they take and stuff? And I think it's just easier to quantify. But if you think about the cognitive and the emotional developmental piece of it, it doesn't manifest immediately, but it might manifest 30 years down the road. That's really scary. It's really scary if you don't get it right.
Yeah, but remember, so that was the first reaction of everyone. And then D.W. Winnicott rolls in and says, whoa, 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 okay, don't freak out all the parents. It's okay for them to cry a little. It's okay for them to not get what they need. Actually, they do best when that occurs, right? So as long as you're not being abusive to your young daughter and you're doing the best you can and you have awareness that this is important, you should be all right.
I've got a follow up on that. So I don't have kids, but I've always thought about this growing up, now being in my 30s, and just thinking about my own parents having me when they're 35, having my older brother when they were 30. And it's shocking to me, right? I mean, obviously a different time, but I look back at the lessons that I've learned and how my philosophy has changed, right? From being an 8-year-old to now, and being grateful for the lessons I've learned. But during the time period of childhood, you look at your parents and you say, oh, I wish, why didn't I get this cell phone at this time? Or why didn't I blah, blah, blah. But then you look back and you become grateful for those lessons. So can we ever be right as parents? I've listened to Gabor Mate as well and how we can do things better maybe. But I feel like no matter what you do, your children can always see the opposite, right? So if parents financially support, for example, some children will say, man, I wish you were stricter on me so that I could learn how to be more financially savvy on my own. And then you see on the opposite end, if they weren't financially supporting you, man, well, now I'm in a rut and I wish you were able to financially support me, right? So how, and I think this ties into suffering, right? So is it just that humans, no matter what, will always find an issue as they grow up with whatever it is? I'm just curious about that.
Yeah, no, that's fascinating. And then it also ties into the earlier discussion about control. Like, you can't help the fact that you are who you are. And therefore, you're going to do what you're going to do. And there's also definitely something to the fact that people seem to have inborn tendencies that they're born with. And they just have a certain disposition. And then there's that variable of how the ego structure of the child was. So, it's a broad topic you bring up. Sharpen it a bit. What exactly are you getting at? Before I go into a 2-hour lecture.
Yeah. No, sure. So it's really about how growing up, we're always going to find faults in whatever the way we were raised because it's not ideal. And I think every time we look at our own circumstances, it's, man, only if I learned this would I be out of this circumstance. But then you get out of that circumstance, or maybe you have an opposite circumstance, and it's, man, well, if only I wish the opposite, that I would be out of this rut, right? And it takes a person to have that radical acceptance, to have gratitude and realize that, hey, regardless, like I made it to this age and it could be worse, right? And so I'm wondering, is there, when it comes to a parenting and that relationship between the parent and child, is there really a way that we could do it better or be right or help the child as much as possible so that they become more, quote unquote, wholesome?
So the problem is the presumption by the child that they actually know what's good for them. Right? You're dealing with an inexperienced ego personality that wants certain things. And when they don't get it, then that leads to anger and frustration. And so, that's also part of this human condition and very normal. And I don't know that you would want a parent to modify what they think is best because of a child's dissatisfaction with the fact that they can't have another paid app on the App Store today. And so it's inherent that there's that dynamic friction as a child is growing up. But I feel like there's a deeper point here that that's worth bringing up at this point, right? If you think about it, there's everything distills down to aversion and desire, right? Like an individual is fraught with these desires and aversions. I want chocolate ice cream, and I don't want to have people say bad things about me, right? And if you think about it, our entire life is painted with us trying to go after the things we want and to avoid the things that we don't want, right? And I guess that's fine. You have to have a compass. You have to know what you're going for, and you have to know what you're avoiding. And that's really not a problem. But then there's a certain subset of those desires, aversions, or also fears are in the same bucket, that kind of rise to a fever pitch. They become what they call in the Eastern philosophies binding, which means I must have chocolate ice cream. If I don't get chocolate ice cream, it's going to be a problem for me and you, mommy. And then we got ourselves a problem, right? Kid goes to the ice cream store. Mom is all excited, taking the child to get ice cream, and they say we're out of chocolate. All of a sudden, temper tantrum, scene at the store, and what could have been a beautiful scenario ends up horrible, as the mom has to like haul the kid out and screaming all the way back home that they didn't get their chocolate ice cream. So that's because it was a binding desire. It wasn't just a suggestion that I'd like chocolate, but sometimes you don't get what you want. You might get vanilla, and that's also good too. And so the magnitude of binding desires and fears in a person is directly correlated to their level of suffering and distress in life. And in the masterpiece, the Bhagavad Gita, Lord Krishna beautifully explains the entire story of the human experience from start to finish, and it's framed around these two elements, binding desire and binding fears. And the entire path, the entire art form of growth in Vedanta and in Buddhism, the systems I'm most familiar with, is the purification of the mind of these binding desires and fears, to turn them into just desires and fears. And when you approach that line where those binding desires and fears are unbound, then you approach something that I've come to realize is sanity.
I love that. So I'm super glad that Darsh offered that disclaimer, and so hopefully people stuck with us. But let's bring this back to kind of our patient interactions, right? Ravi, we last time we spoke about how people look at Eastern philosophy, Eastern medicine, and Western medicine as two these distinct things, and we kind of look at it as a spectrum, right? When you want to try to add as many tools to your tool belt. I'm wondering, understanding how a lot of people will look at philosophy, psychology as even a soft science, yet there are some sound principles that are applicable to ourselves, our patient interactions, that can really be sometimes the most potent medicine, if I may, for that specific scenario. Recognizing that, I'm wondering how you have these conversations with your patients, particularly here we're all in the States where we practice, and these concepts of these meta conversations, these philosophical and Eastern concepts, they're not well understood, they're not well taught. Yet maybe there are now a little bit better, but even as you were growing up in your training and even now, there are a lot of people, depending on what part of the country, who are not familiar with this. So how do you open up this conversation and introduce people to it, particularly your patients, when they approach to you with any type of specific ailment that they might be struggling with?
Yeah, I don't think you could tell that petulant child screaming for chocolate ice cream that they have a binding desire that they need to unbind, and actually expect that to work out too well, right? Um, so I typically don't get into it directly, but these concepts are used to inform the way that I approach the person itself, right? Like, we want to teach people to accept what is, and to not have a problem with, to not have resistance to what is. And perhaps the best way to do that is to accept them, right? These in psychiatry, often you get patients that no one else likes or wants to have anything to do with, and it's a strange and unusual experience for them to encounter another human that's sitting there with rapt attention, present and focused on them, and doesn't seem to have a particular problem with their rough edges of their personality or get triggered by it. rather is fascinated and curious about how they became what they are and what their dreams and wishes are and where they want to go. It almost disarms a part of the person. And in repeated conversation with that person experiencing that, something softens in them, right? And they start being able to maybe accept a little bit more of themselves, because they're not dealing with a person on the other side of the table who's telling them how worthless they are and how useless they are. And this is a strange experience that someone could actually accept them. So then maybe there's a space where they could start to accept a little bit more of themselves, right? So the trick is experiential. It's to create a container, an experience for our patients and the people that we work with to actually have a different experience, a corrective experience. And then after that occurs for a period of time, the person is naturally very curious. Like, what the hell happened, right? Like, I wasn't as angry as everyone and people were treating me differently. And like, now I'm confused. And then that's where the education component of this starts. And so it's kind of this back and forth where the goal is not to teach a person so much as it is to heal them.
I love that, right? It's about the healing and them getting to understand their own biases and own philosophies and such. So, nowadays we have psychiatrists, we have psychologists, we have life coaches, and so many different disciplines as well, right? Positive intelligence, to CBT, DBT. There's so many different things out there, right? And each kind of have their own flavor of really teasing out everyone's individual philosophies and such. But how do we balance that more humanistic approach that so many people think of with what we would now say is a lot of science, right? We look at the DSM-5, we look at billing and coding, and there has to be a specific diagnosis in there, right? In order for kind of things to work and for the next steps to happen. So how do you balance out maybe being scientific with the patient, but also this more humanistic philosophical component?
Well, I understand it for what it is. A person is what they are, but you need a descriptive language to describe the situation. And for me, that is exactly what the DSM is. It's a descriptive. It's certainly not based on mechanism of disease, but it's a description where, if a person has X symptoms and presentations, this time course and whatnot, then they carry a diagnosis or a label of XYZ. And then there's a body of research that tells us what to help with people, what could help people with XYZ, right? So I think that personally, I don't have a problem with it. Like it's just now I know how to be very specific, technical, and precise in what the issue is from a symptom presentation level. But the DSM never spoke to me and told me what the root cause of any of these things are. And so I had to go figure that out in different ways.
And then how do you check your biases too when it comes to a patient? Let's say, for example, you truly believe in logotherapy and life's mission is to find that purpose. Knowing that, how do you reconcile maybe what you tease out from the patient and really check your biases?
So we have to be careful not to project our own beliefs and theories on a person or any experience. Remember, we were talking about suffering, right? And I pinch you, and then all of a sudden you tell yourself a story, and then now you're looking at me as some sort of perpetrator instead of a guy that got confused about what he was pinching. Like it happens, maybe. But so in the same way, when you look at a patient or someone you're working with, you don't want to contaminate your experience of the person with these theories and notions. You just want to be with the person and see what you feel and see what's there in the connection. I don't know if that's as gratifying an answer as you'd like, but the point is not to look at a person as a set of labels and names and terms and diagnoses. It's to actually holistically experience the person. And they can tell, like people know when you're with someone who's actually with you. and connected to you, versus someone who is looking at you analytically and trying to figure out how to judge you.
Yeah, yeah. Which honestly leads into my next question about back to control, right? And this relationship between patient provider. And we often talk about the best relationship, this best rapport is kind of this ping pong where one can, explain and the other can take it, but also share and be more vulnerable and have this back and forth. And, Adam Grant says there's three different types of ways you can teach someone, right? You can be a professor, you can be a prosecutor, or you can be a preacher. And so those three really having just a different flavor of, volatility versus the tone of voice. But when it comes to control, right, I think a lot of times as a life coach, and hopefully I will be one in the future, you think about how you had this extensive knowledge and how you can really impart this knowledge on someone and that you quote unquote have the truth. And this person may just not see it, or they may need to be taught it in order to, unlock that door for their mind to really accept who they are and take that understanding in. So when it comes to control and you look at the relationship between you and the patient, how do you view that idea of control?
I want to say that, the need for control in a treater comes from their own insecurities and their own fears that they don't know what they're doing. And so then you end up with this paternalistic dynamic where the physician or the treater has a limited fund of knowledge around the situation, and they've sized the situation and put it into a box that they know how to deal with, right? To the doctor who understands magnesium deficiency, everyone is walking around with magnesium deficiency, and or it's B12 deficiency, or it's vitamin D deficiency, or it's too much cortisol, or there's so many different pet diagnoses that a treater will get into. Deep down, they know they don't know everything. Right? But they do know that they need to know what to do with this patient and what what the problem is and what they're going to do about it. And if they don't, all of a sudden it creates this fundamental insecurity and fear, an imposter syndrome. Like, why are they paying me? Like, what am I going to do about it? Like, I don't even know. So they don't even go there, because that would be horrible, because that would unravel their entire sense of self and their entire professional identity. So then the way that they've been taught by their senior doctors and the people that they've been trained by is to know. And if they get questioned, then comes a control dynamic. No, you are patient. I am doctor. You will listen to me as I tell you what's wrong with you, and you will take the damn magnesium, and you will get better. And whether you would have gotten better on your own or not, I don't know, but at least 60% of the time I see when I give magnesium to a person with stiff muscles, they get better. Could do yoga too, maybe. But no, do the magnesium. So then when we talk about this control thing, I think I've kind of dispensed with it in my own clinical practice at this point. Like, what's there, right? Like, at the end of the day, this person, it's their life. And they're the ones who have to walk this journey of healing and growth and trying to come through it. And I'm but a mere consultant that comes along in the path with some additional skills and knowledge to assist them. And so then the higher bar is, can I be of value to you? Can I think with you? Can I add something to the way that you're approaching this with the addition of my knowledge and experience and, to a certain degree, wisdom? And so then all of a sudden the control dynamic dissolves and gives way to this learning together approach to care. And I think people respond really well to it. I would say that this discussion about control is probably one of the root causes of poor compliance with treatment, right? And when people don't take their medication and they just say, I forgot. But if you actually dig beneath the surface, I didn't forget. They just don't necessarily believe that you understand exactly what's wrong with them enough to put this chemical in their body every day. And so they're ambivalent about it. And so, it's really important to actually, as healers, as we grow and rise in our own journey, to work on getting rid of that so that we can form those authentic connections with our patients and our clients and whoever it is we're working with to actually be optimally useful.
It's funny that you brought up that example of, when you are a subject matter expert in something, you tend to identify and diagnose that specific ailment a lot more. I
Fast.
think about our field of physical medicine, and again, almost everybody who walks into our office or clinic is suffering with some type of pain, some type of musculoskeletal issues, neuromuscular issues. And oftentimes the treatment that you might order or suggest or intervention that you might do, might be addressing the problem from some lens that somebody hasn't looked at before. So you talked about psychiatry, we're PM&R. And by the time somebody's coming to us for knee pain, they've already seen 2 orthopedic surgeons and 2 family medicine doctors, and we have to be a 4th or 5th in line. So I tell my trainees, I'm like, unfortunately, all the simple things have already been done. So I have to think outside the box. And I find myself like looking at these uncommon diagnoses and diagnosing them far more often. Now, as a result, I'm become better and better at doing that. And so then sometimes I also have to question myself, and I like to sit there and have a deep discussion about the patient and about what they've suffered or how they've suffered and how long they've suffered for. And then also, understand their impairments in quality of life, their function, their goals, all the things that maybe nobody ever did before. Maybe somebody looked at a knee x-ray, saw they had arthritis and just injected it because that was the easy thing to do. Got them out. Nobody addressed them as a human being and acknowledged their suffering. And so whatever treatment I offer at this point, whatever injection that I do, is it working because I've truly diagnosed something uncommon, right? Is there a structural issue, or is it because we've established a therapeutic alliance that they never had before? I always wonder that. And I share this maybe for my trainees listening to say that it's almost impossible to disentangle, right, the mind and the body when somebody is going through that suffering. I mean, they're so tightly interlocked that you do have to address both. If you don't, then neither one is going to be successful. The thing I'm thinking about, you talked about the stories piece. A really awesome book comes to mind, Crucial Conversations. And in it, they talk about how people tell themselves these stories anytime they have an interaction or argument with somebody. He talks about, the authors talk about people, they create victim stories, they create villain stories, they create helpless stories as well. Some people were like, oh, this happened to me, life is hard on me. And then, or other people will get angry, like somebody did this to me, right? They were bad to me. And maybe those aren't the facts. And other people will say that maybe there's nothing in my control and there's nothing I can do about this situation. I always find that interesting as well, because you have some people who have this victim mentality, is like, life is hard, residency is hard, everybody's out to get me. And, the author always talks about, like, he's got a whole algorithm we'll link into, like, how you can kind of, overcome that. But some of the things that is like, just see here, like, what evidence do I have to tell this story? Right? Do I actually have any evidence, or are these just feelings and emotions that we've created? Like, people don't put emotions on us. We create our own emotions from a simple thing that happened. As you mentioned
It's
at
the
the
way
outset
you
of this,
said
it's the way, right? Right. Right. It's the way you pinch Darsh, right? It's not that you pinch Darsh, it's the way you pinch Darsh. So I think that's really interesting. So I guess, all this to say, you have to be in a very mindful place. Last time you spoke about between the puff of smoke, maybe it was, and then, how it feels like, in there's freedom, right? So as you acknowledge everything that's going on, same thing in these conversations, same thing when you're telling these stories is, if you can sit there and create that space about what's happening with the story and what are the actual facts, I mean, that's mindfulness at its best. So we've talked about that, Ravi, quite a bit, about how that can help expand the reservoir so you can take hits to the system, so you can decrease suffering. And I think one of the surefire ways that cognitive behavioral therapy, any practitioner that's working with somebody, psychologist, is helping somebody with decreasing their experience and their suffering, is helping build resilience. So I'd like to maybe shift and focus a little bit more about that, see it as actionable as we can be. as if it's in our control. How do we help ourselves and maybe our patients build more resilience?
Okay. So one thing I want to emphasize here is you pointed out that we can uh, increase our resilience by having this space, this mindfulness, and learning how to uh, not suffer. The point is you can actually transcend suffering. You don't minimize it. Once you understand the world differently, there's actually the possibility of having freedom from suffering. So if we take the typical victim mentality that you see, right? Person is like, okay, typically I see it in a work scenario. My boss keeps doing this. Like no one likes the boss. The boss is giving me so much work. And like, I work all night and like, it's horrible. And like, I need to leave. Doctor, I need you to like, give me a work slip so I don't have to go to work. And then they come to the point, right? And, there's something about that narrative that puts the person as someone who's being perpetrated by the boss, right? But what's missing from that is the fact that this person is showing up to work every day and actually doing that instead of choosing not to do that and empowering themselves. And why do they do that? Because they have a fear that they may lose their job, or that they may get a negative review, or they have a binding desire for a promotion, or for someone to say something good to them, or to get a raise. So they're really fraught with these binding desires and fears in that scenario that traps them into a skewed perception of the scenario, and it turns them into a victim, and then they suffer as a consequence in that box. And this is what you want to free the person of, right? Is by actually showing them in a mirror. No. The real problem here is you want to raise. You want to be the one that the boss says is the smartest, sharpest, hardest working person. And you want to not displease your perfectionistic tendencies, for example, right? And so once they understand, oh my God, you're right. Like, I really have those intense needs. Like, if anyone says anything negative about me, if I even get a 4 out of 5 on a feedback form, I'm going to like have an issue, right? Then all of a sudden there's this space where they start taking ownership of the situation that they're finding themselves in. And once they've done that, then they can make a new deal with themselves, which is like, I accept myself as I am. I do what I can and I do the best I can at it. And this is apparently what it looks like when a person is working hard, has respect for work-life balance, and is delivering productivity. If they like it, then I'll stay here. And if they don't like it, I guess they'll tell me to leave. And in that statement, when they can actually go through it and understand that that's a better scenario than destroying themselves in order to be a victim, they've achieved freedom, right? There's actually that arc where you've moved from being a victim to empowered and then found freedom in that scenario. And when that's done repetitively in every sticky scenario a person finds themselves in, their relationships, with their friendships, because it's all the same dynamic again. And a person who's bound by their fears and aversions and desires are going to have this problem in every scenario, right? So it's actually possible through a growing insight of what the mechanism of what's going on for a person to actually transcend it and be free of suffering. And this is actually what Lord Buddha was teaching, right? Exactly what he was teaching.
Absolutely. I was just about to say that. Yeah. I really appreciate that you use the word transcend, right? Because it really gives people that mental model that it's about breaking through something, breaking through a plateau, breaking through something that you're stuck. Because in the end, I mean, whether you quantify suffering 1% of suffering versus 50% of suffering, it's still 100% of suffering, right? And so getting comfortable with suffering, understanding what it is, truly living in it, and then transcending it, right? And quote unquote, being enlightened, which is what the Buddha was saying. So I really do appreciate you using that, because I think it's such a powerful way of looking at the victim mindset and these fears that we have is really, how do we transcend the state rather than just reduce the state? So I mean, with that,
Correct.
yeah, go ahead.
And when you reduce the state, it's like rearranging deck chairs on the Titanic. It may be marginally useful on the margin, and you may feel slightly better now, but you haven't really fundamentally solved the problem that leads to it. So you figured out how to distort the external reality to please you and your binding desires and fears sufficiently that the amount of suffering reduces in that moment of time, which some may call resilience. But realistically, the goal is transcendence. Is like, whoa, 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 whoa! I'm voting off of this freaking game. Okay, like I understand now. I'm responsible for my own happiness. I'm the one who's the master of my destiny, and my productivity that I give my boss is what is sustainable. Let each day not take from the next day. Maybe I'm a little bit better tomorrow than I was today. Except occasionally I have to like pull an all-nighter. It happens once every year, but that's fine. I understand what we're doing. So I understand sustainability as the line at which I work. And then that's what I offer. And then what happens is there's an unlock in that person. There's joy that comes out. There's this feeling of abundance that comes out of the person. And so then all of a sudden, 8 hours of productivity from that person is equal to 15 hours from the burnt out victim mentality, suffering human who's trying to do something with absolutely no creativity in their pain.
Yeah. It's never ending in that cycle.
So you actually win. You can categorically show that by transcending, you actually optimize all of your outcomes.
Yeah. I love that.
Which is a fascinating.
Wow. Well, Ravi, we know, I mean, we've been talking about philosophy here now almost about an hour. And I mean, from what we've all talked about with your immense knowledge, if you want to share, I would love to hear how your philosophy has changed through life, and through the ventures that you've been through the profession, through the story you've told us in our first episode. How has your outlook and life changed, and how has your growth changed?
Wow, it's fascinating, right? I'd say, to catch people up a little bit, 25 years ago or so, I was the founder of a technology startup, and we invented the Find My iPhone feature. It was a brilliant innovation, the idea that you could put software and find lost or stolen devices. And that business didn't go, it was a technological success. I mean, the idea is on every single mobile device on the planet, but it didn't go my way commercially. And it slung me into a depression. And I've been on a journey, starting at that point, trying to figure out what the story is with suffering and sadness and what have you. And what's interesting is it helped me realize that I needed to actually dedicate my career to figuring this out if I was actually going to make edgewise progress. So, when we talk here about it, it makes it sound simple, but it's actually a journey for each of us to actually internalize these lessons and to grow through them. I think the point is being able to have walked this journey with so many souls over these decades and taking that journey sincerely and working hard through it has been so pivotal in rising my own wisdom and understanding of these things. It's a journey. We're all, as I pointed out earlier, we're all learning together.
Yeah, no, I truly believe that. And, I recently read The Untethered Soul by Michael A. Singer. And there's a reason that book changes a lot of people's lives, because you start to realize everything is energy, all is connected. Like you said, we're just all souls kind of in this together, connected, maybe not, all looking to grow, maybe, or accept. But in that book, one of the chapters talks about death being your greatest teacher and using that concept of death to really understand life and what it is right now, right? And he uses a great example that I use with everyone now, is that if you're in your hospital bed and the doctor tells you, hey, you only have 1 week to live and it's raining outside, most people outside who don't get that told that, hey, you only have a week, or, oh, it's raining, I need to shelter myself, get inside. But that patient in the hospital looks outside and says, man, what could I do to feel the rain for one last time? Right. And so really just accepting what most people would say is suffering, right? I think that is true transcendence, is that when you're truly in that present moment and saying, man, every moment, every touch, everything could be my last, right? And so that book for me has really changed my outlook on life, and has really changed the way I philosophize with myself and the people around me. When you talk to patients and you've seen an improvement in their mental health or maybe their outlook, what are some of those themes that you really see as the main factor for that improvement and that positive change?
It's this stuff, taking people on journeys that help reduce suffering.
Yeah.
And, there's not much we can do to change the pain and the knocks that we get in life. Things happen, right? We lose jobs, people get sick, there's disease, there's a change of fortune. But through the changing winds of life and what it throws, learning to have a different relationship with it all, right? Moving into that space of acceptance and being able to view things objectively has probably been the biggest theme, at least in the people I've worked with. Maybe it's a part of the way is the style of my work as a clinician, but that leads to durable change. And yeah. And also, it's inevitable. I feel like people are on this journey inherently of growth and development. And everything we go through in life is our biggest teacher. And it's like a storybook that keeps unfolding. Each chapter begins when we open our eyes in the morning, and the next lesson is learned. And sometimes they're painful lessons, and sometimes they're pleasant lessons. So the element of time is also not to be underestimated in how people do.
Brilliant. Well, Ravi, these are always incredibly enjoyable conversations. I think we've learned quite a bit from you in the 2.5 hours that we've sat down together, and even the conversations we've had offline. I'm wondering where some of the providers that come into contact with you, if you don't have the time to sit down for an hour and have this type of conversation, where are some places that you can point to them, resources, maybe books, some of the ones that Darsh mentioned, that might help them achieve transcendence?
Great.
Providers, patients, even, honestly.
Yeah, humans. Let's say, right. All right. So the situation in my mind is that these ancient Eastern philosophies, they nailed it. We have a certain some people have a bias that because it's old it means that they didn't know anything back then. But we're talking about scholars who spent like millennia working this out and thinking very carefully. And they didn't have screen devices or other distractions. They would just sit there and focus and meditate and debate and have these discourses. And they really did work out the wisdom of the human condition. And what's fascinating about those bodies of knowledge, literally not a syllable has been changed for millennia. They signed off on it and said that this is a complete understanding of the human condition. And so I would encourage people to study, like, what did Buddha teach? What did Krishna teach? And explore it. So if you want to look at this from the Vedic side, the Bhagavad Gita is the most brilliant summarization of this entire story and how it works. And there's any number of good translations out there. Devdutt Botanic made a pretty good one of the Gita that is really accessible and easy to read. But I would say, like, dive into the actual source texts and learn from these ancient masters and from modern teachers who are unfolding their truths to you, because they're utterly simple. Right? When things get too complicated, when people have too many theories of why a person is the way they are and so on and so forth, I've learned over time that it's just more thoughts. And when it starts coming down to its elemental and most essential nature, like Ask yourself when you're suffering, what is it that you want so bad that if you don't get, it's a problem for you? Ask yourself, what is it that you are so afraid of? What is it that you don't want to happen so bad? And if you ask yourself that question every time you find yourself struggling, you may actually start having correct thinking that'll actually move you in the direction of resolving it and growing and continuing on your journey. So, yeah, a lot can be said. And then also, the fundamental skill that has to be developed is the ability to observe your thoughts and observe your mind without judging them, and to be able to accept them as they are. So you have to be the witness of your mind as opposed to being your mind. And that skill set is fundamental to undertaking any of this work. And so that has to be inculcated by picking up a practice of meditation. And, even 1-2 minutes, watch the breath. It's a start. And trying is the all important thing. So if you develop that muscle of being able to bring your attention where you want it to be, the meditations are, and develop that skill set along with some ancient wisdom, you'll be in a good stead. I don't know if that belongs to the realm of psychotherapy, psychologists, or to anyone in particular, but I think it belongs to humanity. And it's at that level that we have to have respect for those universal insights, because the teachings are applicable to all of us.
I think it belongs to modern wisdom, which is clearly what you have to offer. And so, where can listeners learn from you? You're clearly a man who thinks deeply about things and has a lot to offer. You mentioned your company, your website last time. Where else can they follow you? Is it on social media? How can they connect with you?
Yeah, social media is good. I'm making this transition from being a small practice guy to trying to serve society in a bigger way, to have this kind of wisdom grounding a larger system of being able to take care of people. And so, as I do this, I would love everyone's support and wishes, and you'll probably be hearing more and more from me as I make my progress in those domains. But um, what I'm saying is universal truth, and there's so many wisdom teachers who have this to share. Um, Reach out to me if you want more resources or you have a question. Write me. I'm on LinkedIn. It's an easy way to find me, and I'm always happy to help a fellow traveler on the journey.
I love it. Ravi, want to thank you, man. Thank you for taking the time to kind of enlighten us, to help us think a little bit, and hopefully people have stuck around and have paused, like Darsh suggested, and taken the time to think. And whenever they're ready to come back and dive deeper into this in their own journey, they can do that. I want to just recap and leave the listeners with a couple of things. I mean, right, we've talked about this a lot, and so just understand that pain is inevitable, but suffering is not. And as you mentioned, yes, resilience is a short-term tactic, maybe even a hack for the day-to-day hits that you take to the system, but transcending is the ultimate key to minimize that suffering. Not easy to come by, but it is achievable. And we both of you guys have talked
I
about many people,
swear
and
it's easier than suffering.
good point. That's a very good point. And trying is the ultimate thing, as you mentioned. Every now and then when you are doom scrolling on social media, you do come across a gem. And a couple of days ago, I saw a high school valedictorian giving his speech, and in it, he was talking about, it goes something like that. His mom told him that hate has four letters, excuse me, but so does love. And enemies has 7 letters, but so does friends. Cry has 3 letters, but so does joy. And negativity has 10 letters, but so does positivity. So we have a choice. And when you're in that moment of telling yourself a helpless or victim story, understand that there is a choice, and we could always choose the better outcome. So
Great
thanks, Ravi.
summary. Great summary. Nice.
Thank you, Ravi.
Thank you.